Hi, folks. Welcome. Hi, everyone. Do you want to take a moment to introduce yourselves in the chat, please? Let us know your name, where you're zooming in from, and where you work or what you do. Pop into the chat your name, where you work, or who you're here on behalf of, and where you are calling in from. All right. Hello, everyone. We have a lot to cover today, so we are going to go ahead and get started. But while we are getting started, please go ahead and drop your name, your organization, and where you're calling in from in the chat. So my name is Marisa Jones, and I'm here on behalf of Safe Routes Partnership. We are a national nonprofit organization that works to make it easier, safer, more fun and joyful and equitable to walk and bike and wheel to and from school and throughout communities. And we do this work to support kids and people of all ages, abilities, and disabilities to move throughout their communities and in everyday life. And we do this work in a number of ways at Safe Routes Partnership. One of those is through policy change. We advance policies and secure funding at the federal, state, and local levels in support of walking, bicycling, and healthy, equitable communities. We support Safe Routes to School program development and implementation through partnerships with local advocates, community leaders, neighbors, and coalition partners, including some of the panelists that you'll hear from later today. We provide one-on-one coaching and consultation services to state, local agencies and organizations all across the country who are looking to make their communities more walkable or bikeable. They're looking to start or strengthen Safe Routes to School programs. And we do what we are doing today. We share our deep expertise and what we learn from the field. We do that through providing free, accessible webinars like this one today, as well as a number of reports, fact sheets, toolkits, and resources that are free and accessible to anyone on our website. And we are so excited to be celebrating 20 years at the Safe Routes Partnership. Actually, just yesterday, we launched our 20th birthday celebration. We are so excited to be celebrating this milestone, and we encourage you to scan the QR code or keep an eye on your email, your inbox for emails from us about how you can plug into celebrating our 20th anniversary with us. So a couple of housekeeping items for today's webinar. The question that we always get asked, is it being recorded? It is being recorded. We will post the recording on the website as well as the slide deck. You will have access to all the slides. All the resources that we talk about today are linked in the slide deck. So you will get all the information here. And the chat is open, so go ahead and freely chat in the chat box. But if you have questions for any of the panelists, please put those into the Q&A box so that we can keep track of them. And with that, we're going to dive into today's content. So I'm going to give a background on why the Vulnerable Road User Safety Assessment exists. So I want to start by saying that at Safe Routes Partnership, we really try to focus on walking and bicycling and wheeling as healthy, active, fun ways of getting around the community. I know as just a regular person and as a mom of 3 kids that somebody talking to me about how scary and dangerous walking and biking are, that doesn't really make me want to walk and bike. So as an organization, we really, while we are constantly working to improve the safety and the equity for people walking and bicycling, we mostly try to lean into the messages of how this is good for our health, how this is good for our well-being, how it's good for building community connection and social cohesion. So I want to just name that this is a bit of a departure from the way that we often talk about walking and bicycling, but it is so critical, especially at a time like this. And I want to be clear again that we are talking about roadway safety as a devastating challenge, and we will leave you today with new knowledge and skills on how to use the Vulnerable Road User Safety Assessment as a tool for improving safety. So roadway safety, if you're here, you likely know this is a big problem in the United States. Over 40,000 people are killed on our roadways every year. And for kids, the traffic crashes are the second leading cause of death. We also know that this is not a burden that is borne equally across this country. Traffic crashes disproportionately affect Indigenous people, Black, Latino, and people with low incomes. There's also a foundation for roadway safety to be a national responsibility. You'll notice I don't say it is a national responsibility or it is a national priority, but there is a foundation for it to be. And one of the ways that we think about, we look at the Federal Highway Administration's website, and this is current as of the other day under this administration. The Federal Highway Administration, which is the federal agency responsible for streets and roads and highways across the country, they talk about the role of the Federal Highway Administration is to make the transportation system, which they define as roads, sidewalks, trails, work for people of all travel modes. So it is imperative that we are focusing on keeping people safe, regardless of how they move around our country. So what is one of the ways that, next slide, please. Okay, so the title of this webinar is Making the Most of Your State's Vulnerable Road User Safety Assessment. And I know that is such a jargony term. And so I wanted to start by defining who are vulnerable road users. The simplest way of putting it is that vulnerable road users are people who are using the roads and are not inside a car or a vehicle. And I want to be clear that road users are made vulnerable by our societal lack of planning and lack of supportive infrastructure for our mobility. So we are made vulnerable as people walking because we have not been planned for. There has not been infrastructure developed for us. And for those of you who are here for the nerdy things that I really love, like citations of federal law, here is where vulnerable road users are defined in federal law. I'm a visual learner, and maybe some of you are too. So let's take a look at some of the pictures of who vulnerable road users are. There are grandparents, there are older adults, there are peers, there are people using mobility devices, elders in our community. There are parents and caregivers pushing strollers, people using wheelchairs and other assistive and adaptive devices. And those of us who ride our bikes around town or scoot or skateboard, any wheeled conveyance, using adaptive devices, people who are gender nonconforming or present in a way that is not in keeping with societal mainstream, their parents and caregivers, neighbors, and their kids walking to and from school and in everyday life are all who are part of vulnerable road users. So to talk about what the Vulnerable Road User Safety Assessment is, we need to understand a little bit about how federal transportation law and funding work. And this is going to be a dramatic oversimplification. This is not covering every single way that federal transportation law and funding focus on vulnerable road user safety assessment of vulnerable road users. We are focusing specifically today on the Vulnerable Road User Safety Assessment. So we're going to talk a little bit about where we were and how we got to the Vulnerable Road User Safety Assessment. So for many, many years, there has been a program called the Highway Safety Improvement Program, otherwise known as HSIP. And the purpose of this program, the stated intent, is to achieve a significant reduction in traffic fatalities and serious injuries on all public roads. So this is a federal program that Congress created, appropriated money to, and that money goes to your state Department of Transportation to do a couple of things. The first is to use a data-driven process to develop a plan called a Strategic Highway Safety Plan. And then from that plan, identifying projects, implementing those projects, and then evaluating the safety impact. I know oftentimes at the partnership, we come to you and say, hey, this is great funding you can apply for as a local community. That's not this. The Highway Safety Improvement Program is up to your state Department of Transportation to decide how they want to spend the funding. And one thing I do want to share, though, is that while the majority of the funding is to be used on infrastructure, building, engineering improvements, proven safety countermeasures, up to 10% of a state's highway safety improvement program dollars can be spent on non-infrastructure, including safe routes to school and specifically including safe routes to school coordinators. And then another misconception that we often hear about the Highway Safety Improvement Program, I want to dispel, it can be used on local roads. It is not only for state roads. So the Highway Safety Improvement Program has existed for a long time. Next slide. But even though we have this program that is a data-driven program that is intended to keep road users safe, we see a mismatch between people who are dying on our roadways. So this is in 2020. Almost 20% of the people killed on our roadways in 2020 were people walking and bicycling, so non-motorists outside of cars, vulnerable road users. And then when we look at the amount of highway safety improvement program dollars, that funding I just talked about, that, oh, it's intended to reduce roadway injuries and fatalities, we look at how much is being spent on keeping vulnerable road users safe, projects for people walking and biking, it's less than 1% of the funding. And the reason I talk about this time period is because this is the time period that Congress was working on the federal transportation law that created the vulnerable road user safety assessment. So we see this big disproportionality. 20% of people dying on our roads are walking and biking or outside of cars, and less than 1% of the Highway Safety Improvement Program dollars are being spent on projects to keep vulnerable road users safe. So next slide. So let's unpack that a little bit. If HSIP, Highway Safety Improvement Program, is a data-driven program, why was it not aligning with the data on vulnerable road user crashes? So one of the reasons is that there's a lack of planning that has been done at the state level to illuminate areas of concern for serious injuries and fatalities for vulnerable road users. And frankly, some of that comes down to crash patterns. So crash patterns involving vulnerable road users follow a different pattern than crashes involving just cars. Crashes involving cars tend to cluster at hotspots, and crashes involving people walking and bicycling tend to happen along corridors. And so without focused planning and understanding these patterns, these trends are not popping out in the state strategic highway safety plan. And then also we think about when the State Department of Transportation is the one doing the planning, they are not at the same level of granularity as, say, a local community that knows, oh my gosh, the intersection of Main and, oh my God, what's another road? Market, that is really unsafe. But that's a local road that maybe the DOT they're zoomed out a little bit and not at that level of granularity. Another reason that the HSIM money was not aligning with the percentage of traffic patterns is that oftentimes when a DOT, a State Department of Transportation, runs a program, it reflects their priorities. And this is just something that we see across the board. It's not a judgmental statement, it's just an observation. And so states are allowed to transfer up to half of this money, the Highway Safety Improvement Program money, out of the program to other priorities. So maybe they have a pet project, a new bridge, a highway widening that needs some more dollars. It is acceptable under law for a state to transfer the money. And about half of states were doing that in 2019, even though we were seeing rates of bicycle fatalities were at their highest since 1987, and fatality rates for people walking were at their highest since 1989. So even though we're seeing that, and this is money intended to decrease roadway injuries and fatalities, almost half of states were transferring money away from the program. And then when we look at states' strategic highway safety plans, where they have to identify, here's what we are emphasizing, this is our emphasis area, not all the states are focused on safety for vulnerable road users back in 2020. And then also there's just a lack of incentive. There's nothing incentivizing a state to do this. And finally, it wasn't required for them to do so. And so there are just a lot of states that were not doing it. So enter the 2021 Infrastructure Investment and Jobs Act. That provided an opportunity to use this existing source of funding, the Highway Safety Improvement Program, to better reflect the reality of who is dying on our roadways and address some of those pain points that I presented on the prior slide to compel states to start understanding the traffic crash patterns and then spending money on projects to keep vulnerable road users safe. So in the lead up to the 2021 transportation law, Safe Routes Partnership and partners like the League of American Bicyclists and others worked with champions in Congress to enhance the Highway Safety Improvement Program to focus on vulnerable road user safety. And the Highway Safety Improvement Program got a lot of enhancements in the Infrastructure Investment and Jobs Act. Funding increased by 24%. Vulnerable road user provisions were added in throughout the Highway Safety Improvement Program. Eligibility for lots of new kinds of projects that keep people walking and bicycling and using mobility devices safe became eligible for HSIP funding. And what you're all here for, it required states to complete a vulnerable road user safety assessment. And it created a special rule that says if your state has 15% or more of the people dying on your roadways are not in cars, are people walking, bicycling, vulnerable road users, you have to spend at least 15% of your HSIP money on projects that keep people safe. So again, going back to that pie chart where we saw the big wedge of people walking and bicycling killed, but the very tiny sliver of funding spent on them, this was really intended to address that. Okay, so what is the Vulnerable Road User Safety Assessment? At its most simple, it's a regular analysis conducted by your state DOT of crashes involving people outside of cars. So what is required by law for the Vulnerable Road User Safety Assessment? The state must analyze all fatalities and serious injuries of vulnerable road users. They need to identify high-risk areas. They need to list both strategies and projects to address those high-risk areas. Because it's an HSIP program, within HSIP, it has to be a data-driven process. They are required to consult with stakeholders, and they're required to complete these by November 2023, and then every time their strategic highway safety plan is updated. So I linked here to more guidance on this from the Federal Highway Administration, and again, we can talk another day about the special rule. Next slide. So all the states have completed these. What have we learned? What are the high level trends? Then we're going to hear from 3 states, or we'll hear profiles in 4 states. So all the states completed their VRU safety assessments by November 2023. And frankly, they're a bit of a mixed bag, especially when we talk to state and local partners about how they think their state reflected the reality. So we know that less than half of states identified specific projects, which is really challenging because in order to turn from this plan into actual improvements on the ground, they need to get to the project level. We recognize that the top strategies that they included are both education and engineering. And engineering we especially love when it's proven safety countermeasures. And education, as a Safe Routes Partnership, we love non-infrastructure, but we love when it's evidence-based non-infrastructure. So not just like safety campaigns that just make people feel good. And then when we look at who was consulted to develop these plans, all states consulted with their MPOs. About 2/3 consulted with local governments, which is actually fewer than I thought. I would think all of them consult with local governments, and less than 2/3 of states consulted with advocacy and community groups, and we would love to see that change moving forward. And again, you'll hear today from others how they engaged on this. And then my last thing before I pass it to Vanessa, as your friendly Safe Routes to School bike ped lobbyist, I need to tell you what's next for the Vulnerable Road User Safety Assessment. So Congress right now is in the process of writing the next surface transportation law, which will set policy and funding for the next 5+ years. And we, along with other partners, are advocating for the continuation of the Vulnerable Road User Safety Assessment and special rule. And we invite you to read along on our federal policy blog and keep apprised of our e-news for advocacy updates and action alerts on this topic. I will pass it to Vanessa.
Thanks, Marisa. Let's see here. Thank you all. My name is Vanessa Cassio. I'm the Program and Policy Manager at Safe Routes Partnership. And before I hand it over to our dynamic panel of speakers, I'm going to briefly chime in with some of the work that we have done to support communities to access the Vulnerable Road User Safety Assessment, and just share a little bit about our work supporting Pennsylvania communities. So in 2023, as part of our Safe Routes to Parks program, we began working with 4 local communities in Pennsylvania. And we're hearing, as we started to work with them, we're hearing some common challenges and barriers that they were experiencing to advance biking and walking in their community. And some of these challenges might sound familiar to you, they might resonate with you. The first of which was, many of these communities knew exactly where there were local issues. They knew where there were safety concerns, but really didn't know where to begin, or were feeling sort of uncertain about the first step to take towards meaningful change. In fact, one of the communities that we worked with, that's here in the photo, we conducted a walk audit with community members, and quickly they identified intersections that they knew were dangerous. In fact, one of which a young boy was tragically hit and killed. We also worked with communities that not just knew the safety concerns in their community, but also had plans already in place, but were really struggling to translate those plans into action, right? And really needed the momentum to fund and implement real projects. We were also working with communities that face some complex jurisdictional barriers. So some of the dangerous roadways going through their community were not locally owned or managed, making it really challenging for local leaders to know which agencies to approach or how to effectively advocate for change. And lastly, we're working with communities that weren't tapping into these new opportunities that Marisa had mentioned that were brought up as part of the 2021 transportation law. One of those opportunities being the Vulnerable Road User Safety Assessment. So really to address those gaps, we really wanted to clearly connect these challenges and experiences in local communities to this opportunity to participate and engage with their state Department of Transportation, um, who are undertaking the Vulnerable Road User Safety Assessment planning in 2023 in Pennsylvania. And so the DOT led the planning process in that year through a series of engagement opportunities to gather feedback through regional meetings, stakeholder engagement, and a statewide survey. And we really illuminated this opportunity and its potential impact to these local communities, in part because Pennsylvania also qualified for the VRU special rule, which was that 15% of their highway safety improvement program funds had to go towards addressing safety for non-motorists. So in fiscal year 2023, that translated into $18.8 million of investment was required to specifically target non-motorist safety. So our overall message to the communities that we were working with that were struggling to kind of make change happen was to get involved in this planning process. And here are some of the sort of steps we coached them through that hopefully you can sort of take away and apply in your communities or states. The first of which was to participate in these engagement sessions, to share the local perspective. So for them, this meant like keeping tabs of when these meetings were and inviting local agency staff to show up and participate in these virtual sessions, and really being able to ground truth some of the data that the DOT was analyzing and putting together, to really illuminate what were the local experiences of community members navigating these roadways. The second opportunity was the DOT had this statewide survey, and so we really encouraged communities to promote the survey through their newsletters, social media channels, through their outreach events, to ensure that the DOT was accurately identifying these high-risk areas and could reflect that in their statewide plan. The third opportunity and coaching point that we shared with communities was, remember all those plans you have on the shelves? We'll dust them off and really elevate the projects from your plans that already exist. Elevate the Safe Routes to School projects, the Vision Zero projects, the local road safety plans, or in our case, we were working with a local community on a Safe Routes to Parks plan, and they were doing this robust engagement, these community events, these pop-up events, and they encouraged their county transportation planner to participate in the VRU planning process. And it was great because the planner had this data from their Safe Routes to Parks plan that they could elevate and really show that even in a rural community that maybe wasn't showing up on the DOT analysis, that there was safety concerns and issues that needed to be integrated in the statewide plan. Which leads me to the next point is we really encourage communities to call out areas of concern, even if the crash data didn't show that it was a concern, to really help to supplement the picture and the analysis that the DOT was presenting. We also encourage communities to, elevate and educate their agency partners on the new flexibility within the transportation law to use HSIP funding. Like as Marisa mentioned, there's a number of ways that HSIP funding can be used to address safety and to maximize additional funding like transportation alternatives funding. And lastly, we really encourage communities to elevate and prioritize evidence-based solutions. So those proven counter safety measures like lighting, traffic calming, bike lanes, and sidewalks as part of the solutions that could be integrated in the vulnerable road user safety assessment. So those are some of our takeaways from our work in Pennsylvania, but I'm also really excited to hand it off to our panel of speakers today who will be sharing about their experience in advancing vulnerable road user safety assessment in their community. Sorry, here I'm having a challenge with advancing my slides. Give me 1 minute. My computer's not liking this right now.
You want me to share, Vanessa?
Yeah, I might need you to, Marisa.
Okay.
I'm gonna have to restart this.
All right, give me 1 second. Sorry, folks. My goodness. Ah.
Thanks, Marisa.
Sure.
So I'm gonna go ahead and introduce today's speakers and then hand it off to our first speaker. But at the top of our list here is Michael Kelly, the policy director from Bike Walk KC, hailing from Kansas City. Next up, you'll hear from Susan Gettert from 1000 Friends of Wisconsin, where she serves as the community programs director. And then last up will be Jacob Van Sickle, executive director of Bike Cleveland. Thanks, Michael, for taking the mic for us.
Yeah, thank you very much, and thank you to all of you for taking some time to join us this morning or afternoon, depending on where you are. So again, my name is Michael Kelly. I'm the policy director for Bike Walk KC. We're located in Kansas City, Missouri, but we do work in both Kansas and Missouri around elements of active transportation at the local, state, and federal level. And we were very fortunate to be able to work with some of our partners in the Midwest to develop this vulnerable road user safety assessment report. Next slide. So I wanted to start by giving a little bit more context to the report that we developed, and I wanted to start with a little bit of background on how we got to this point. So next slide. And so with this, I wanted to start by briefly discussing the organization that brought myself, Jacob, Susan, and our other partners together and enabled us to develop this report, the REAMP network. So the mission of the REAMP network is to decarbonize the Midwest by the year 2050. So they're hoping to do this work by bringing together organizations working on a number of different issues, but that all work towards this central theme of helping to improve the region's climate. Transportation has often been identified as a major priority, and this is true with REAMP network. Transportation is our nation's largest source of greenhouse gas emissions, and the REAMP network recognizes this. What has changed in recent years is a greater acknowledgement of the importance of supporting multimodal options as a form of mode shift. So previously, there was a really big emphasis on electric vehicles, electric cars. We had to get more people into electric cars. And with time, they've come to realize that electric vehicles certainly have their place, but if we're really serious about moving the needle and really lowering our emissions and lowering the amount that the pressure that we're putting on our climate, we really have to invest more in aspects of walking, biking, and transit. And so as that has changed, so too has the importance of transportation overall evolved in that organization's list of priorities. And so with all of that being said, the REAMP network provided some funding for the report. After some of the initial conversations among our partners, some of whom you'll hear from later, Bikewalk KC put forth a proposal to take a closer look at the VRUSAs of several states across the Midwest: Iowa, Kansas, Michigan, Missouri, Ohio, and Wisconsin. REAMP provided the funding that allowed us to do this work, to which we once again want to say thank you. And I also want to take a moment to acknowledge our other partners from this coalition that put together this report. Todd Scott, Zanaya Kelly from Detroit Greenways, Megan Owens from Transit Riders United, also in Detroit, but also Carrie Carney, our friend from 1,000 Friends of Wisconsin, or 1,000 Friends of Iowa, in Des Moines. Next slide. So in terms of the report that we have here, and the link is there in the chat. Thank you for dropping that in, Corey. I wanted to take a minute to go into more detail about how the VRUSA report we wrote is organized. So first, with regards to recommendations for FHWA guidance. So the report begins by looking at different aspects of the guidance provided by state DOTs and making recommendations. So acknowledging that this was the first iteration of the Vulnerable Road User Safety Assessment, the authors of this report, myself and others, wanted to develop options that FHWA specifically can consider to improve their guidance for state DOTs. The vast majority of these recommendations ask states to provide greater detail on the existing elements already requested for the Vulnerable Road User Safety Assessment, rather than identifying new additional steps or sections to develop. Additionally, we had a section devoted specifically to state VRUSA observations. So this section of the report really gets into the details among the 6 states that we looked at. It provides general observations on what most states did to satisfy the requirements of each element of the VRUSA that Marisa alluded to earlier. For example, when looking at the summary of consultation element, we found that the bulk of consultation and engagement for this specific group of vulnerable road user safety assessments appeared to focus on internal state DOT staff and or decision makers at the regional and local levels. This section also provided more details about what each individual state did to satisfy each element of the VRUSA. And then finally, we set aside a section towards the end of the report where we talk about how these VRUSA observations can be used to help improve aspects of walking, rolling, and biking in each state. We didn't want these elements and these considerations to exist in isolation. We really wanted it to be part of a broader conversation that needs to happen around how state DOTs are considering, are planning, and ultimately building for the safety of people who choose not to, or for whatever reason are unable to drive in these states and states across the country. Next slide. So this leads to the question of how we examined the VRUSAs to identify priorities for each state. So it began by identifying dangerous corridors. So one of the ways that the VRUSA can be useful for local and state level advocates is that it can offer an opportunity to identify dangerous corridors. This matters in a state document like the Vulnerable Road User Safety Assessment, because there may be instances where a state hasn't previously identified certain corridors as dangerous for people who walk, roll, or bike, or a local community lacks a formal plan itself or document to identify those dangerous corridors. In Kansas, for example, KDOT actually developed a vulnerable road user safety assessment tool that identifies dangerous corridors throughout the entire state. This is an important step as in acknowledgement of where those hotspots are, but it's also helpful to inform local leaders of where they should work to prioritize the limited funding available for safety improvements. Additionally, the VRUSA can be helpful for advocates who are working to understand the gaps in states' policy or planning efforts with regards to active transportation. So because the VRUSA is inherently an explanation of what a state is or isn't doing to address traffic violence among people who walk, bike, or roll, it can help advocates to further demonstrate what a state has or may lack. So in Missouri, for example, the VRUSA is helping the state advocates such as Bike Walk KC and others to reinforce a broader push that we've been making for the last couple of years about the fact that Missouri is one of only 4 states that currently does not have any sort of statewide active transportation plan. And so the VRUSA we see as an opportunity to help push MoDOT to finally take that step of getting in line with national best practices and ultimately developing their own statewide active transportation plan. Finally, beyond both of these elements, we shouldn't overlook the fact that this was the first iteration of this document for all 50 states. So there is more that states can and should be doing to learn from each other's VRUSAs to elevate and mimic best practices. So this is perhaps best exemplified in the myriad ways that states we examined developed their summary of consultation. Some states were much more robust in terms of what they looked at, while others were much more minimal and kind of narrowed in their focus. And so we wanted to put all of these elements together so that people like you could see what other states are doing in real time and also begin to consider, are there examples that you can pull from Ohio or Wisconsin or Kansas that may help you in advocating for a stronger, updated VRUSA somewhere down the line. And so with that, I'm happy to pass things over to my colleague Susan to talk more about Wisconsin.
Thank you, Michael. So I'm Susan Gettert. I'm the Community Programs Director at 1000 Friends of Wisconsin. And we're coming up on 30 years. We were founded in 1996. And what we do is work statewide at the community level to support healthy, thriving communities, specifically through land use and transportation. And we are looking at how climate, health, and equity come together in the built environment. So big, lofty goals, but that's what we do. You can go to the next slide. So when it comes to our VRUSA, it is within the Strategic Highway Safety Plan, which is a document put together by by WSDOT, our Wisconsin Department of Transportation. And some of the most important statistical information that I wanted to pull out for this presentation was some rather sobering statistics. The number of crashes in Wisconsin has gone down, but unfortunately the severity has gone up. So we're seeing more fatalities and serious injuries, especially for pedestrians. 3/4 of those crashes are happening in urban areas. More victims are male than female. We're not really sure why. And these last two bullet points here point to some really stark disparities. We are seeing that only 0.2% of the road miles in our state are responsible for nearly a third of VRU crashes. And we're also seeing a huge disproportionality of disadvantaged communities represented in those VRU crashes. So while that's not like good news, it does tell us where the work should be focused moving forward. You can go to the next slide. So one bright spot in our VRU assessment was the consultation section. So there were a fair number of stakeholders and other groups like that the DOT talked with. So there were surveys to inform our first ever active transportation plan. So Missouri, you're not the only one. Ours should be coming out later this year. There was a pretty extensive survey of the Wisconsin Bike Fed, which is our statewide bike advocacy organization that are very involved in a lot of street safety projects. They also surveyed our 5 MPOs and did some deep interviews with 4 of our cities, Green Bay, Janesville, Madison, and Milwaukee. And I want to put this photo you've seen like 3 times in this presentation. And I just want to point out that this is from a walk audit conducted at Fond du Lac Avenue in Milwaukee, which is the most dangerous road in our state. And you can kind of see why. There's a person there who's standing at the very corner between the slip lane and the rest of the road. And I don't know if you can see it in the back of the photo, but there's a bunch of orange barriers because this was taken last July during the Republican National Convention. And that security zone was right there just beyond where we did our walk audit. So there was probably less traffic that day than there would have been normally. You can go to the next slide. So some of the key takeaways, like, you know, big picture look, when we looked at our VRU assessment, the approach for improving these numbers for VRU crashes focuses a lot on education and enforcement, and it does offer some information for infrastructure, but not a lot of specifics, and it's clearly not a priority for our state. So that's disappointing because we know that these are systemic issues that require systemic interventions, and yet focusing so much on education and enforcement is really looking to an individual, picking away at individuals to try to solve the problems. Also, in that sort of bigger systemic level, funding is an issue here. You know, most of the money comes through the state level, and yet the responsibility for planning and carrying out projects that would actually improve infrastructure and safety falls on local governments and MPOs. And we would really benefit from having more leadership and coordination from the state on things like Safe Streets for All grants, complete streets, and other policies. And the last thing is, like, not to be a huge wet blanket here, but in terms of engagement, it tends to look a little better on paper than in practice, which we know from having participated in some of these things. A VRU assessment is kind of a wonky technical thing that may not engage the general public very much, but we are talking about street safety and trying to improve outcomes on our roads. And in general, our state tends to not be as open and public as we would like to develop some of those plans. You can go to the next slide. So one thing that's really important to us at 1000 Friends of Wisconsin, as well as the other groups here, but we focus a lot on how transportation and climate intersect. This graph on the right, I know it's a few years old, but this is statewide emissions data. And the pie chart doesn't really look a whole lot different now than in 2018. Transportation is one of our biggest emitting sectors. I think electricity production may have shrunk just a little bit because of renewables, but transportation is still responsible for a huge chunk of our emissions. And we know through our work and working with communities that we can have all these co-benefits by creating a built environment that supports safety for vulnerable road users. So if we can make our roads safe for walking and biking for that 31% of Wisconsinites who do not drive, we can improve equity, we can improve health outcomes, we can improve social cohesion, and we can also reduce emissions because people won't be driving as much. And what we really want is for the state to take these policies seriously and show some leadership in reducing emissions through the transportation sector. So we are developing our first ever comprehensive climate action plan. That's with some EPA funding, and we've done a lot of advocacy to push for good metrics there. We are looking at reduction of vehicle miles traveled per capita. Long term, there are a couple of state policies that we've been advocating for a long time. Regional transit authorities are illegal. They are prohibited in our state, and that's a real, that has a crippling effect on our local transit agencies to be able to deliver good transit service. And we could really use reinstatement of a complete streets policy at the state level, because again, that tends to fall to the local governments and NPOs who don't have the resources to do all that themselves. So I've just got one more slide, and I will just say that we also work on some highway stuff. So we oppose the expansion of highways, and we're advocating in one case to replace a highway with an at-grade boulevard, because we understand how well all these issues are connected. And I think that's all I've got. If you have any questions, please feel free to contact me or visit our website at 1kfriends.org. I'll pass it to
Michael, Marissa, Vanessa. I'll get started real quick. My name's Jacob Van Sickle. I'm Executive Director at Bike Cleveland. We serve the greater Cleveland area. Our mission is really to create a region that's sustainable, connected, healthy, and vibrant by promoting bicycling and advocating for safe and equitable transportation for all. Next slide. And while our work focuses primarily in the city of Cleveland, we do have a chapter program that allows us to support advocacy and education efforts in our suburban communities, helping build a regional movement for safe streets. Next slide. Our work can really be broken down into three buckets: advocacy, education, and encouragement. Our advocacy work is really built around coalition building through Better Street committees at the neighborhood level, advocating for safe streets and infrastructure and traffic calming, doing tactical urbanism, as well as policy and legislative advocacy. And our education programs focus around reaching people of all ages and abilities on bikes, things like bike camps. We have a senior program called Silver Spokes in our community education classes. And our encouragement programs include community rides, bike to work day, promoting Week Without Driving, anything that really kind of brings a social element to bring the community together. And this particular project was really, with REAMP, really focused on our advocacy bucket, working to create systemic change that improves safety for all road users. Let's start by looking at the data from the Ohio Department of Transportation, ODOT, so I use that term a lot, VRUSA. According to ODOT data from 2018 to 2022, there were 4,100 crashes that resulted in a serious injury or the fatality of a vulnerable road user. And it's not a fringe issue, it's a systemic one. These crashes account for 11% of all fatal and serious injury crashes statewide, which is disproportionately high toll for people biking, walking, and using mobility devices. But even more alarming is where these crashes are happening. More than half, or 52% of vulnerable road user fatalities and serious injuries occur on just 8% of Ohio's roads. So that tells us we know exactly where to focus our attention and resources. And yet, despite knowing this data, ODOT has publicly acknowledged that it's failed to meet its vulnerable road user safety goals for both 21 and 2022. And we know, looking at the data for 23 and 24, the trend is still sobering in meeting those goals. And this highlights a critical need for more ambitious action, accountability, and community-driven solutions. Next slide. So through our analysis, we found ODOT's VRUSA action plan recommends some positive changes that we think are important to highlight. First, it encourages multimodal planning at the state and local level, which includes modernizing outdated design guidance and revising metrics like level of service, which currently prioritize vehicle flow over safety. ODOT's VRUSA does note that the transportation system should reflect our values, and that means putting vulnerable road user safety first. When it comes to implementation, the plan highlights a need for more investments in separated bike facilities, not just painted bike lanes. They recommend prioritizing high-risk corridors where we know crashes are concentrated, and for many communities, especially those with limited resources, providing help with the local match requirement. For equity, We need to make sure, according to ODOT, and I agree, that our VRUSA is centered in equity. So ODOT conducted an equity needs analysis, bringing in all types of data, including car ownership, poverty level, education access, as well as proximity to schools and proximity to workplaces, to really help define an equity area and promotes targeting investments in those areas where there's most need. And good decisions require good data. And, ODOT recommends improving how vulnerable road user crashes are reported, because we know many go unnoticed. In fact, in Cleveland here, our staff and volunteers have reviewed 911 call data and crash reports the past couple years, and we found that almost 45% of bike ped crashes go unreported in our state crash databases. To this concern, ODOT recommends creating a process to collect near-miss data and monitor non-motorized traffic volumes to better inform safety planning. Their action plan also includes recommendations for education and training, both for engineers and law enforcement that need training to understand the safe systems approach, and for the public in terms of awareness campaigns and creating accessible materials that explains how infrastructure changes are designed to save lives. And then lastly, ODOT notes the need to break down silos and develop partners across sectors, including local government, advocacy partners, and agencies, so that they're sharing best practices and supporting project delivery. While there's some good, next slide. While there's some good, we identified some gaps through our analysis. The first is, while the safe system approach is mentioned, it's only in passing, and what's missing is a clear structured section that shows how this framework is being systemically applied across the state with projects. Without that structure, it's hard to know if the principles are actually guiding decisions or just being referenced as an afterthought. Another concern was around the stakeholder consultation and transparency, and ODOT in their report outlined stakeholder buckets, which included MPOs and big and small cities, and including the Amish community, which is great because we have a large Amish community in our state. But there's no clear record of which advocacy organizations or community groups were consulted. Stakeholders, especially those closest to the issue, deserve to know how their voices were included or if they were at all. And then one big gap we noticed is a lack of measurable benchmarks within the action plan. If we want to move the needle on safety and stay accountable, we need to define what success looks like and track that progress along the way. And then lastly, the report, in my eyes, really missed an opportunity to bring the data to life. Within all these crashes, we're talking about real people. We're talking about people's mothers, sons, or neighbors whose lives are changed forever by preventable crashes. And personal stories are a powerful tool to build public and political will for change. And leaving them out of a report like this risks making the issue feel abstract or technical rather than urgent or humanizing it. Next slide. So how do we use the VRUSA for advocacy with some concrete next steps? I think first, talk to your metropolitan planning organization to see if they're aligned with your DOT's finding and VRUSA action plan. Are they identifying the same high-risk corridors? Are they adjusting their priorities based on the data? MPOs are a critical link between state and local decisions, so their alignment really matters. Hold your DOTs accountable. It's not enough to have a plan, but we need to follow through. Ask for updates on specific action items. What's the time frame? What's the progress that's been made? And when we follow up consistently, we help keep safety commitments from getting buried. Then use the data to guide your own advocacy. In our case, ODOT has identified high need areas and corridors. We'll use that information to focus our efforts, whether we're organizing a campaign, attending public meetings about projects that are upcoming, or applying for funding. Targeted advocacy is effective advocacy. And don't stop at words. Advocate for real adoption of a safe systems approach. That means more than just referencing it in reports. It means pushing for changes in how our roads are designed and how decisions are made where safety is baked in. And really, this is our opportunity for real change. That includes advocating for funding in the highest risk areas, redesigning dangerous arterials to prioritize safety, it must become a way DOTs are planning and designing our roadways. Then for my last slide, I did want to provide kind of a good case study about how this data and the reports are important. So let's take a look at a real world example that illustrates why we need a shift in how safety funds are used. This example is Kinsman Road. It's one of our most dangerous streets in the city of Cleveland, identified in our action plan as a priority. And it's part of our high injury network, meaning it has a high concentration of serious crashes involving people biking, walking, and driving. In 2022, ODOT invested $2.4 million into this corridor using state safety funds. And a paper that sounds like progress, but when we look at what was actually built, it tells a different story. The project added turn lanes at all 4 approaches of the intersection. And while this may help reduce rear-end crashes and improve flow for drivers, it also widened the roadway, increasing crossing distance and exposure for pedestrians and people using the corridor on bikes. So I highlight this just to note, it's important that a lot of these safety projects, especially in the media, can be highlighted as positives, but there's deep details when you're thinking about other road users that come into play when these investments are being made. And with that, there's my contact info, and I'll turn it back over to the Safe Routes Partnership folks.
Thanks, Jacob. Thanks, Susan. Thank you so much, Michael. It was great to hear all of your advocacy, and hopefully you all are leaving with some sort of tangible ideas to advance the vulnerable road user safety assessment in your state. We have a few minutes left for 1 or 2 questions. So I know we have some questions in the Q&A, some of which we've been answering via the typing function. But I'm curious. So one person was asking about their specific state and how could they find out if their state qualifies for the VRU special rule. Marisa, I don't know if we have any tools available for states to easily look that up, but that's something that
I'm happy to answer that one. So
yeah.
Everyone knows we just had an administration change at the executive level, federal level. The prior administration was posting online who qualifies. This administration is working through the Federal Highway Division offices, and so states are being notified. We are working to analyze and look at the data to calculate the fatality rates to then be able to post it. We want advocates to know and communities to know whether or not their state qualifies. We're disappointed that this DOT is not being transparent with this. So your state will be notified by the FHWA division office, but we will work to post that information as well.
Thanks, Marisa. We have one more question about funds, using HSIP funds as match for TAP projects. And if we have sort of tools or resources that we recommend for champions to pursue for the non-federal match. That's probably a whole webinar unto itself. But if we can maybe, Marisa, I don't know if you have any resources or sort of links that we can maybe point this person to or recommend maybe a one-on-one consultation.
Sure. And hi, Matt, who asked that question. Thanks for the work that you guys have been doing to be innovative within your state DOT. I would say one thing that we're doing at the federal level and that Jacob and Michael have both been involved in from an advocacy perspective is there's a bipartisan bill in both chambers of Congress called the Sarah Debbing Langenkamp Active Transportation Act that addresses one of the challenges that states currently using highway safety improvement dollars as match for TAP, but they still need to come up with that amount of local match. So this basically, when I presented that slide on states don't have an incentive to do this. One of the things that this bill does is it restructures the law in a way that incentivizes states to use HSIP as match for TAP for safety projects. We have a ton of information on our website about this, and Jacob and Michael have both been instrumental in lobbying on behalf of this bill. So thank you both for your work. And we can share out in the follow-up resources other opportunities for local match. State DOTs, you all are amazing and innovative and resourceful and helpful often. So we can send out some of the examples that other states are doing, but just one that I'll plop in there if you have them, toll credits. There's a $30 billion toll credit balance. We just put out a resource on using toll credits as match for TAP. So lots of opportunities, definitely a whole topic unto itself.
Great, thanks, Marisa. And then we had one final question sort of geared towards Ohio. Jacob, I see you're typing the answer. I don't know if you want to chime in with a response.
Yeah, I mean, the question was, how do we track the percentage of roadways that encompass the majority of our crashes? And that was a data set that came out of ODOT's VRUSA. I know other cities have done that basically by calculating crashes and mapping them and determining, based on where they're happening, coming up with that percentage. But again, that data was from the ODOT VRUSA and the analysis they did for developing it.
Thank you so much, everyone. We're actually at time, and as we mentioned earlier, we'll be sending out the recording to this webinar and the slides. And as you are departing, I want to make one final plug for our Safe Routes to School Summit. We have early bird registration open. Mark your calendars for October 28th to October 30th. And again, I want to thank our incredible panel of speakers, Jacob, Susan, Michael, for taking the time to really share your insights and give us ideas of how we can advance our states to steward funding to address safety on our roadways. Thank you all so much.